I am a registered nurse in Nashville, Tennessee, and my name is Kalila Mitchell. I'm reaching out to everyone about the COVID-19 vaccination. I recently took the COVID-19 vaccination. After the shot, I felt fine, but within 3 days, I went to the doctor because I had problems with my face. The whole left side of my face, actually. I have Bell palsy now. And as you can see, I can't smile. I'm trying to smile. I'm just getting embarrassing for you. But I just want everyone to know that I think this vaccination is the worst thing ever. And I would not give this to anybody, even my worst enemy. Please, America, they do not care about us. Do not take this vaccination.
I think this illustrates that the vaccine effectiveness is not immediate.
Health experts weighing in after a local nurse tested positive for COVID-19 8 days after receiving the Pfizer vaccine.
This was a Facebook post from Matthew, an ER nurse at 2 different local hospitals after receiving the Pfizer vaccine December 18th. He tells me his arm was sore for a day, but he suffered no other side effects. 6 days later, on Christmas Eve, after working a shift in the COVID unit, he became sick, he writes in another Facebook post. He got the chills and later came down with muscle aches and fatigue. The day after Christmas, he went to a drive-up hospital testing site and tested positive for COVID-19.
Not unexpected at all, and when you work through the numbers, this is exactly what we would expect to happen if someone is exposed.
Dr. Christian Ramers is an infectious disease specialist on the clinical advisory panel for the county's vaccine rollout. He points out it's possible Matthew may have been infected before receiving the vaccine, as the incubation period may be as much as 2 weeks. But Dr. Ramers says if Matthew did contract it after the vaccine, it's still in line with what we know.
And we also know from the vaccine clinical trials that it takes about 10 to 14 days for you to start to develop protection from the vaccine.
Dr. Raymer says he knows of several other local cases where healthcare workers became infected around the time they received the vaccine. He says all of these cases illustrate that results are not immediate. And even after you start receiving some protection, it is not full protection.
That first dose gives you, we think, somewhere around 50% protection, and then you need that second dose to get up to 95%.
Dr. Raymer says,
I work in corporate America. I've managed hospitals for years. Okay, I'm helping out as a consultant, making sure everything is being done properly. Yes or no, patients have rights. The other thing is, patients also have a thing called HIPAA, where we shouldn't be putting them on camera. We should be protecting them. If they are positive, you're violating that.
First of
no,
all,
no
on your
big deal.
certificate,
No big deal.
you spell HIPAA wrong.
Huh?
You spell it HIPPA. It's HIPAA. So on your own
Okay.
certificate, you spell it wrong.
Okay.
So,
Are you
okay.
taking
don't
swabs
lecture
from
us
these
on
folks?
HIPAA.
Excuse
Are
me?
you taking swabs from these
You
folks?
have to, man.
Okay, where are those swabs being sent?
They go to the lab.
genetic
What lab?
Okay.
The genetics lab takes the swab. We have a relationship with the genetics labs, doctors, nurse practitioners, and all these are professionals in the medical field.
Are these folks nurses or health
Yes.
professionals?
Yes, everybody, man. We've done everything we can to make sure that not only we're employing the people right here in Louisville, okay? I've done many interviews, many different things right out here. We're doing things the right way. We don't have anything to hide.
Y'all ain't even qualified to do testing here. Yeah, that's what I thought. Y'all ain't got no answers, do you? See? These are the people that are trying to take your all's DNA. Do not allow them to.
How are y'all doing? Where are you from? Hello. Where are you from? Where are you from, ma'am? Kentucky. Whereabouts in Kentucky? Your mama's house. Oh, your mama's house. I got you. How's your mama doing? Hey, how's your mama doing? Is your mama doing all right? What are y'all doing? Are you trying to rip people off? Charge you $240 for some stuff? Don't have anything to say? You want to talk? Don't want to talk? Hello?
Welcome to Kentucky, baby. That's how we do it. That's our testament right there. Go on and pack it up and leave, and every time we see you around here, we're going to chase you out. because y'all not going to come down here and get our people's DNA. Nope. Get your shit and get out.
Around 30% of seriously ill patients are developing these clots, and here in the U.S., doctors report strokes, even in patients under 50.
The COVID-19 bioreference lab. Here are the test results. As you can see, 5/1/2020 at 17:16, not detected. They test for a second time, 5/4/2020 at 17:59, not detected. So both of those are negative. Scroll up to the top. This is my patient. They are on a vent and they are being called COVID-19 confirmed.
So not detected here, but it's presumptive. Now they are detected. They're saying it's positive, not detected. But it's not detected. What does that mean? So
you said that they were vented immediately upon being brought in. Is that?
Yeah. So the thing is they're coming in with difficulty breathing, and a lot of these patients are really coming in with anxiety because they're scared.
So we're supposed to. He's not DNR, but we're treating it as DNR. Basically. Does his family know?
His family knows the situation. I think they called them and they told them. They were trying to do a school attending consent for DNR. Okay. All day he spent like in the 80s saturating. It was this one on the forehead didn't work. It was this one worked, and it came back. When I changed it, I was like, oh shoot, it's 90. Yeah. So they started playing around with the pencil.
Oh shoot, it's 90.
Because he's still on pressure.
He changed the pulse ox
You put him on EC,
from his head to his finger, and he's like, oh, it's 90. He's fine.
Well, Elmhurst does have a policy given, like a COVID policy, given the scarcity of dialysis and blood.
It can be a chem code, it can be whatever.
That it's a difference. Normally the standard is whatever the family says, like we just do. So if they would say code them for 5 years, like you just do that until they die. It's a little bit different now because of the new policy in place with Dr. in place, which is that you don't need full family you can just tell someone that it's medically futile and that we're not willing to just pour blood and resources into something that would be impossible to get back. But he's 37.
All I can think about is that at least he knows that we were fighting for him when he died.
At the hospital, Vega tested positive for coronavirus, and x-rays revealed another surprise: blood clots in his lungs. Vega and many other coronavirus patients, some unusually young, are experiencing blood clots. The clots are impacting blood vessels, large and small, arteries and veins all over the body, sometimes leading to life-threatening conditions like pulmonary embolism and stroke.
After the first 10 days of COVID-19 vaccines, nearly 2 million doses, just 0.2% of people nationwide reported side effects. But there were some serious enough to send people to the hospital for help. Reports we looked through, just from Texas, included one woman saying, "I woke up with severe chest pain like something was crushing me." A 29-year-old woman reported that a rash appeared at the site of the injection, very painful, hot to touch, hard, with rash spreading to her torso. And a woman vaccinated while pregnant reported 2 days after the shot, "I went into early labor. I delivered my baby at 33 weeks.
The vast majority of the reactions that happened occurred within the first 30 minutes of receiving the vaccine. So I would expect that number to hold as we continue forward.
Dr. Crystal Howell, an infectious disease pharmacist at UNT Health Science Center, said the 21 serious allergic reaction cases the CDC looked at is largely in line with what trials showed. Many of the other reactions that have happened
were actually what's called vasovagal or anxiety-related reactions to vaccines, which are very normal.
Howell pointed out people who had bad reactions also had a history of allergies and to a variety of things: eggs, walnuts, tropical fruits, cats, and most were women. For now, the CDC has updated its advice to vaccine locations to make sure to observe people after they get their shot and be ready to treat people immediately if something goes wrong.
So reports from the Alaska Department of Health are that a healthcare worker in Juneau who was given the COVID-19 vaccine developed flushing and shortness of breath 10 minutes after receiving the shot. Now, it's important to note that worker had absolutely no history of allergic reactions in the past. They took some Benadryl, but the symptoms didn't resolve, and the worker was admitted to the emergency department where they received Pepcid, which treats a different part of the allergic reaction, some more Benadryl and epinephrine through an IV drip. The report is that the individual has recovered but is still being monitored. Now, of course, this is the first report of a significant allergic reaction in the U.S., and while it's not necessarily unexpected given the severe allergic reactions that were seen in the UK, as well as the fact that allergic reactions can occur with any medication, this incident will require additional investigation.
We have confirmed with Kaiser officials who say that 43 staff members in its emergency department tested positive for COVID-19 between last Sunday and yesterday. The hospital is working on isolating infected and exposed individuals through contact tracing tonight. All emergency department employees are also being retested. We have also confirmed late tonight that a second related investigation is underway. A staff member appeared in the emergency department on Christmas Day wearing an air-powered costume. A Kaiser official says that any exposure, if it occurred, would have been completely innocent and accidental. The employee was trying to lift spirits and did not show any COVID symptoms. The company releasing this statement tonight saying, quote, even as the vaccine is beginning to be provided in our communities, we are still vulnerable, and it remains critical for everyone to continue using the methods to help protect ourselves and others. Kaiser Permanente says that it is no longer allowing air-powered costumes at its facilities. And despite the outbreak, Kaiser says that this facility is open and safe for staff and all those who need care.
When they had somebody that turned out positive, they would redo the test so that it would come back negative, and they would say that it was a false positive.
Once our testing, the proper way, started coming back positive, we then weren't allowed to collect the samples any longer.
These nurses say the hospital instructed staff to take samples from inside someone's throat, but send them to a lab that only tests nasal swabs, knowing the results would turn out negative. When you raised red flags, what was their response?
They would deny it.
Deny, deny, deny.
This nurse says when she properly administered a test, her boss retaliated.
I did the test, and it did turn out positive, so I was terminated for not having a doctor's order for a test.
And I will say one thing, and I may come as a shock to people. This pandemic has been very severe. It's spread around the world extremely quickly. It has affected every corner of this planet. But this is not necessarily the big one. This virus is very transmissible, and it kills people, and it has deprived so many people of loved ones. But its current case fatality is reasonably low in comparison to other emerging diseases. This is a wake-up call. We are learning now how to do things better, how to do science better, how to do logistics better, how to do training better, how to do governance better, how to communicate better. We've developed a whole new science of infodemiology and advanced behavioral science in this way. So I think from our perspective, the planet is fragile. We live in an increasingly complex global society. These threats will continue. If there's one thing we need to take from this pandemic with all of the tragedy and loss, is that we need to get our act together. We need to get ready for something that may even be more severe in future.
A sobering statement. The death toll in Santa Clara County continues to rise as optimism continues to fall.
I think that we will continue to see deaths increase. They tend to lag the hospitalization numbers.
The county has brought in 3 65-foot refrigerators, like this one at the morgue, to handle the overflow.
The number of deaths among our county residents by week has increased dramatically in December.
So how much do we know about this COVID-19 virus?
We know that it's the same member of a larger family of these viruses known as coronaviruses. They actually exist everywhere. They spend a lot of their time with animals. So this is the third virus that has crossed. So we have SARS-1, MERS, and now SARS-2. We are beginning a completely uncharted journey with this virus. We don't understand a lot because the behavior is completely different. I was very surprised at the outbreak in China, the numbers of people that were infected in such a relatively small period of time. It's very unusual. There are so many talk out there, but it's not following the same rules as the other viruses. This virus is much more aggressive and much more lethal. And for every virus, there is a certain level of lethality. There is a lethal dose. There is how much of this virus you need to have in your lungs before it kills you or before it makes you sick. With this virus, it's not very clear. It's actually very disturbing. There have been some interesting reports that they've had people who were sick and they were cured. They released them out of the hospital and then they got reinfected. The truth is very simple. The assays that we do every day to test this virus, they can only test a certain limit. And if the virus level goes below that threshold, you're not going to detect it. Meaning you're going to release the patient and say you're healthy enough to leave. What I find alarming is we are releasing all these patients, telling them they are virus-free, and they go back to the community. It's not your average SARS, it's not your average MERS. Many people, including me, we start calling it a very mysterious, very cryptic virus because we don't understand it, and it doesn't seem to only attack the lungs, it seems to also attack the heart, and it seems also to attack the liver.
So we're seeing interesting patterns. Not only old people or those with underlying health conditions actually develop this disease.
Now, the elderly are really the first category that get affected a lot because as we get older, our immune system declines. Between the elderly and the adolescent to probably 50, 60 years old, their lifestyles will dictate how vulnerable they are to a virus. What I have observed, which is very different to the MERS, is the rate of infection of young is lower. It doesn't mean that we don't have to close schools or we can let our kids outside play. It means that for now, these are the trends that we are observing. It's not so much for developing a vaccine, but to study the trajectory of where this virus is going. Right now, we're in the middle of a storm, and a vaccine is not going to help. Even if we have a vaccine today, it's not going to help. I think people don't realize that vaccines don't work for every individual that gets the vaccine. Vaccine is a preventative thing. Vaccine is really helping your immune system to kickstart. Your immune system is really what protecting you. The vaccine is just helping, pointing to the immune system where to go. The information that we're lacking from China is about one individual, patient 0. The case in Italy, the cases in Iran, we have few cases in the United States, especially on the west coast of America, where we can't link that fingerprint to the virus from Wuhan. So without that information of that patient 0 in Wuhan, it's really, we are in a bad situation to understand where this virus is going. So that information will be really critical for us to understand the evolution of this virus. And that would really help us stop the spread, not to treat the virus, really stop the spread.
So you're saying that the patient 0 is the key to understand the nature of this virus and contain this virus.
So, yes, patient 0 is really critical to tell us what were these, what we call advantageous mutations that happened from the animal kingdom to the human. The one time it can infect us, that's the transition. It means now this virus figured out that the virus has the key now to borrow, not just to borrow our engine, to borrow the whole body as an engine for the virus to spread. The only way to keep it at bay, if you have a very good vaccine that makes antibodies that's going to neutralize the virus and clear it, that's wonderful. But for 20 years, many companies, many researchers have promised us a virus for SARS version 1. And we are in 2020 and this vaccine doesn't exist. Many reasons. One is there is no more threat, so everybody forgets about it. 2, they have tried and they have identified difficulties that these viruses are not amenable to a vaccine. And because of that, they may need several years of research. The best comparison to that is the Ebola virus in Africa. The only reason we got a vaccine for Ebola is because Ebola decided to leave the continent of Africa and start infecting people in Europe and in America. So those people start getting worried about an Ebola spread on their own soil. And that was the push for government funding to get those vaccines done. Companies will not make vaccines if there is no one to buy it. They only make it when the government is under crisis. So the government can write the check and sign the check and hand over the money. But those governments have not seen a vaccine yet for SARS, and there hasn't been a push for it. Now, perhaps, they will try something, but I am not holding my breath.